Hi everyone, welcome to Medicine on YouTube channel. In this video, we are going to see about osteoradionecrosis. Osteoradionecrosis is an induced pathological process characterized by a radiation-induced pathological process. It is caused by radiation, so it is a radiation-induced pathological process characterized by a chronic painful infection and necrosis accompanied by a late sequestration and sometimes permanent deformity. It is an painful infection which causes necrosis and accompanied with a late sequestration and sometimes causes permanent deformity. It is known as osteoradionecrosis. Osteoradionecrosis is a radiation-induced pathological process characterized by chronic and painful infection. There will be chronic as well as painful infection. The infection will be long-standing and it will be slowly grows and it is very painful, and this leads to necrosis accompanied by the late sequestration and sometimes permanent deformity. The part which gets osteoradionecrosis doesn't work, which is known as permanent deformity. This is the only most complication of the radiation. This is the most serious complication of the radiation to head and neck, seen frequently today because better treatment of modalities and the prevention. It is seen in the day-to-day life because of the better treatment modalities and the prevention. Factors leading to this osteoradionecrosis are irradiation of the area of the previous surgery before adequate healing takes place. Which are the causes? Which are the factors which leads to this osteoradionecrosis are before the healing, when the surgery is done, before the healing, again the area gets exposed due to the radiation. It also leads to osteoradionecrosis. Irradiation of the lesion close proximity to the bone. When the radiation reaches the lesion which is closely to the bone, this also causes osteoradionecrosis. The word osteoradionecrosis, osteo means the bone, radio means which is the radiation, and the necrosis, the bone gets necrosed due to the radiation. Irradiation of the lesion which is close proximity to the bone. Prolonged oral hygiene, continued use of irritants. When there is continuous usage of irritants, which also causes this osteoradionecrosis. Poor patient cooperation in managing irradiated tissue. While managing the irradiated tissue, the patient does not feel cooperate. Surgery is irradiated in the bony areas. Clinical features of this osteoradionecrosis are: osteoradionecrosis is a result of non-healing dead bone. There will be non-healing dead bone seen in the osteoradionecrosis. The mandible is affected more commonly than the maxilla. The mandible is most commonly affected than the maxilla. The histology of this osteoradionecrosis are: there is destruction of the osteocyte, there the formation of cells of the bones gets destructed, and there is absence of osteoblasts, where the osteoblast bone forming cells are absent, and lack of new bone formation, ostear formation takes place. Wall of the regional blood vessels are thickened and fibrous connective tissue. The walls of the regional blood vessels gets thickened by achieving a fibrous connective tissue. Radiation causes proliferation of intima blood vessels leading to the thrombosis of the arteries, which results in non-vital bone. Due to the radiation, there will be proliferation of the intima blood vessels, where the intima is the layer of the blood vessel, which is inside the tube, which is the artery blood vessels, leading to there will be thickening, so it leads to the thrombosis and causes non-vital bone. There will be no blood supply to the bone, and this causes non-vitality of the bone. The treatment are: debridement of the necrotic tissue should be done along with the removal of sequestrum. We should debride the necrotic bone which is present due to there is no supply of blood to that bone, so that there will be sequestration. We should remove the sequestrum. Debridement of the necrotic tissue and should be done along with the removal of sequestrum. Administration of antibiotics should be given, and the hyperbaric oxygen therapy is also essential. Maintenance of the oral hygiene is necessary. These are the treatment for this osteoradionecrosis. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. If you want this video notes, please do follow me in the Instagram page. Thank you.